Welcome to Understanding Human Anatomy. In this video, I'm going to discuss the femur, the thigh bone. So I want to start by sketching in the head of the femur, which is almost a completely round ball. And we come into the neck, and the neck of the femur is quite long. And then coming down into the shaft on the medial side of the bone, we'll have a protrusion, the lesser trochanter. And then we'll come down the shaft of the bone, and then at the distal end it expands out, and we'll have two articular surfaces, and each of those is a condyle, and we'll have associated with it an epicondyle. Let me continue on up, and we're going to go superior to the neck to form a structure called the greater trochanter and join into the neck. Now, down here on the medial epicondyle, there's a bump, and I'm going to exaggerate it, as I often do, to make it more visible. This is the adductor tubercle. So let me clean up the drawing a little bit here. Like so. And let me sketch in and color the articular surfaces. The head of the femur, or at least most of the head of the femur, is an articular surface. And then down here at the distal end we have an articular surface for the medial and lateral condyle, and an area in the middle which is an articular surface for the patella. And what I'm going to do is color in the articular surfaces in a light blue to indicate sort of like hyaline cartilage. So this is the anterior view of the femur. And then start putting labels in. And I'll start by labeling the head. And again, the head of the femur articulates with the acetabulum of the os cocci bone. We'll have the neck of the femur, here. We have the greater trochanter, and I should mention that the greater trochanter actually is a separate ossification center in the young bone. So normally you have one ossification center, a secondary ossification center proximally and one distally. Well, with the femur you have a secondary ossification center at the head, but also at the trochanter. The lesser trochanter and both the greater and lesser trochanters are there for muscle attachment. The medial condyle the medial epicondyle and the condyle is an articular surface. The epicondyle is an area for muscle attachment. The adductor tubercle and we will eventually find that there is a muscle, the adductor magnus, which attaches in part to the adductor tubercle. We're going to have a lateral condyle and again, the lateral condyle is an articular surface. We will have a notch or fossa between the medial and lateral condyles. That is the intercondylar fossa or notch. And when we look at the knee joint, we'll find that there are two very important ligaments that run through that notch. We'll have the lateral epicondyle, and like the medial epicondyle, that is for muscle attachment. And then I want to point out the articular surface for the patella. The patella, of course, is the kneecap, which is going to be situated right over this area, and that's the articular surface. Now that we've looked at the anterior view of the femur, in the next slide we'll look at the posterior view. Now, in the posterior view, we'll again have the head, the neck, and the greater trochanter coming down like so. and then expanding distally in the lateral condyle and epicondyle, the intercondylar notch, the medial condyle and epicondyle. We put the adductor tubercle in and come back up the shaft of the bone, and then making the lesser trochanter, and then finishing the neck. Now again, I want to sketch in the articular surfaces, and of course the head of the femur is an articular surface, and we'll color that in as we did with the anterior view. And then down here at the distal end, we'll have the lateral and the medial condyle. And again, we'll color those in because they are articular surfaces. So let's put some labels in here. And again, this will be now the posterior view. And we'll again label the major structures here. The head, the neck, the greater trochanter, the lesser trochanter, and I want to draw in a couple of other structures. And I've got the greater and lesser trochanter sketched in. And one is a ridge that runs from the greater trochanter down to the lesser trochanter. And this is called the intertrochanteric crest. So let me type the label in here. that is at that spot. And then we'll find a fine ridge of bone. And it starts wide off the greater trochanter and then off the lesser trochanter, and they meet in the middle, come down the shaft like so, and then down at the distal end they separate again. And this ridge of bone, it's not a very tall ridge. It's just a little bit elevated from the rest of the bone. Is called the linea aspera. And it is a line, as the name suggests. Linea is line. And it is important for muscle attachment. And then we'll continue with the labels with the lateral epicondyle, the lateral condyle, the intercondylar fossa or notch, and remember this is a space between the medial and lateral condyle, and the cruciate ligaments will be found in here. The medial condyle the medial epicondyle, and then finally the adductor tubercle. So, that completes the major structures associated with the femur. Thank you for your attention.